Let's review what the goals are for the patient-centered multidisciplinary rounds.
To improve patient and family satisfaction.
To improve teamwork and communication.
Improve efficiency and safety of care.
Improve patient and family engagement.
Prioritizing patient input.
Discuss medical information, transitions, and plan.
Now let's take a look at how an MDR should be conducted and who is a part of this process.
Okay, this is room 589. This is Miss Stephanie Smith. She's a 28-year-old with a history of diverticulitis. This is hospital day 1. She presented with abdominal pain. Okay.
Come in.
Hi, Miss Stephanie Smith.
Yes, sir.
How do you prefer to be addressed?
I like to be called Stephanie.
Okay. Hi, my name is Raymond Zarati. I'm with the hospitalist service. Nice to meet you.
Nice to meet you.
This is Amanda. She's one of the nurse.
Hi, Amanda.
Right, if you don't mind, I'm gonna have a seat.
Okay.
So how is your pain today?
I'm still having some stomach pain.
Okay, how do you rate that pain on a scale of 0 to 10?
I would say it's a 5, which is a little better.
Okay, are you having any associated symptoms such as nausea or vomiting or diarrhea?
No, no, sir, but I'm a bit constipated.
Okay, and how long has that been going on?
I haven't had a bowel movement in about 3 days, and I
Okay.
usually go every day.
Okay. Now this pain, is it constant or is it intermittent?
I'd say it's intermittent. It's not always, but sometimes it just feels so tight. It's achy. It's just all across the center area.
Okay, and how would you describe it? Is it a sharp pain, a dull pain, an ache?
Mostly ache, maybe a little sharp.
Okay. Alrighty, and does anything make it better?
Not that I can recall.
Okay, and anything make it worse?
Sometimes eating. Sometimes eating makes it worse. I love my peanuts, but
Okay.
it hurts when I eat my peanuts.
Yes, and you have a history of diverticulitis, so
Yes,
you're not
and
supposed
salads. Oh, my cucumbers. Can't put them in the salads anymore.
to. Okay. So, Stephanie does not have a central line or a Foley catheter. Okay?
No.
All right, so we are going to order an X-ray just to, have a look at your abdomen. We'll start with that.
Okay.
And we'll make sure that you're on a laxative to help you move your bowels. Okay. Are you tolerating the ice chips and sips?
Yes, sir. Yes, I am. That's refreshing.
Okay. And for VTE prophylaxis, is she on heparin?
She's receiving heparin injections, yes.
Okay.
Oh, I have the bruises to prove it.
Okay. Do you have any questions?
How long do you think I'm gonna be here?
Well, it all depends on how your symptoms do. We're going to start with the X-ray and see if there's anything that's acutely going on. It could just all be secondary to constipation, but like I said, we're going to investigate, and based on how you do, if you start to improve, I anticipate maybe 1 to 2 days.
Okay.
Okay.
That's good to know. And they took some blood from me this morning. Do we know, was that good? Was that good? I've been wondering.
Actually, your potassium came back, it was 3.3 this morning.
Okay. Do you feel like you can take some pills today?
I do.
Or would you
Yeah.
prefer the powder in the water?
I think I'd be okay with the pills.
Okay.
I don't like any fruit flavored stuff. I just like plain water.
If you don't mind, I'd like to have a quick listen to your heart and lungs and your stomach.
Okay.
Okay. All right. Okay, so you have normal bowel sounds, so that's good. So, hopefully the X-ray won't show anything acute, and we can hopefully help control your pain and help you have a bowel movement.
That's my goal.
Do you have any,
I'll update the whiteboard.
okay, thank you. Do you have any other questions or concerns?
No, I think you addressed everything, and I do appreciate the time you've spent with me.
Oh, no problem. Thank you very much for allowing us to take care of you.
When will I see you again?
If you need me, you can have one of the nurses come get me.
Okay,
Otherwise, I will see you again tomorrow.
I will see you tomorrow then.
Okay.
Thank you, sir.
Pleasure meeting you.
Nice to meet you too. Bye.
Ray, I can go ahead and put in that Cena Plus order for you nightly.
Do you have any questions?
None at this time, and my assessment of her showed everything else is normal.
Okay, thank you. Please let me know if you need me.
I
Okay?
will.
All
And
right.
I'll update her whiteboard with the goal.
Excellent. All right. Bye, ma'am.
Bye.
So let's summarize what we just saw. In the multidisciplinary rounds, it takes many service lines to participate and make it successful for our patients and families. We have our providers. We have the primary nurse that's caring for the patient that gives the provider updates as needed. When possible, it is encouraged for the charge nurse or nurse manager to round with the team as well. A pharmacist will also be a part of the multidisciplinary rounds to make adjustments to medications as needed, assist the provider in order entry, and provide medication education to both the care team as well as the patient. So let's remember, all team members should be present for multidisciplinary rounds. Team preparation is important for it to be successful. The encounter with the patient and family should not be rushed and should be conducted at eye level. We should summarize and document all that was found or discussed during the encounter. We should always thank the patient in closing for their time, and the provider and pharmacist should enter their orders outside the patient room. Special thanks to all who participated in the multidisciplinary rounds video.